And hospital leaders are sending out warnings. It is impacting the ability to provide care for the sick. So what is the state doing to respond and prepare for what we have been told by doctors will be some tough days? 7 Action News reporter Kim Russell spoke with the state's chief medical executive, Dr. Natasha Bagdasarian, one-on-one.
Urgent cares around Metro Detroit are busy helping people test and find out whether or not they have COVID-19. On average, every day over the last 5 days, just over 12,000 people have tested positive for COVID. And the state's top medical executive says it's about to get worse.
We're in a very difficult position right now.
Dr. Natasha Bagdasarian is an infectious disease physician and the state's chief medical executive. She says Michigan is positioned under Delta and Omicron. The Delta variant is still hitting Michigan hard. About 4,000 COVID-19 patients are hospitalized, straining our health systems.
Our hospitals are completely overwhelmed. Our hospitals are struggling. We've had to ask for federal assistance. And so we're in a bad place.
And now Omicron is spreading. She says modeling based on what has happened in other states indicates we could see a 1,000% increase in Omicron case rates. That's right, 1,000%.
The best way for me to describe this is a vertical line up. So you see case rates at the level they had been through the fall, and then a very abrupt vertical line up, meaning that things are really spreading in an uncontrolled fashion.
And while fortunately Omicron statistically causes fewer hospitalizations, it still causes hospitalizations and deaths. The volume of cases in a region where hospitals are already unable to provide care to many, are canceling surgeries, and are referring patients to other locations is life-threatening.
What that means is people in waiting rooms unable to get a bed in the floor that they need to go to. It means that people who need to be in the ICU and who need to be on ventilators being closely monitored in the ICU are not able to get those beds because they're simply not available. It means staffing shortages. Staff in hospitals are getting burned out because the staffing ratios are not where they should be. And it is all a direct result of this pandemic. So hospitals are really stretched thin. And the only way that we can help our hospitals help us is by stopping transmission of COVID.
Dr. Bagdasarian says testing, masks, and vaccinations are the tools that we all need to be using to prevent the spread of COVID-19. Kim Russell, 7 Action News.